Welcome to the Case Conceptualization Part 3 Maria regarding TFCBT, created by Aaron M. Smith. Trauma-focused cognitive behavioral therapy is a trauma-informed practice which is founded in the theory of both cognitive and behavioral theory. Basic tenets consist of psychoeducation, as well as narrative building, skills building, developing those coping strategies, cognitive restructuring, as well as exposure therapy. This is an evidence-based practice that has been proven to be effective for those experiencing PTSD or PTSD-like symptoms, specifically disassociation, depression, as well as anxiety. In the article, Latent Class Analysis of Post-Traumatic Stress Symptoms in Complex PTSD in Child Victims of Sexual Abuse and Their Response to Trauma-Focused Cognitive Behavioral Therapy study utilized 384 participants, which were classified as those that consisted of complex post-traumatic stress disorder, classic post-traumatic stress disorder, and resilient, all three of which showed that TFCBT was an effective procedure for improved outcomes. An adaptive imaginal exposure approach to traditional methods used within trauma-focused cognitive behavioral therapy was a qualitative study focused on two case studies, both adult males, both of which, through multisensory grounding and imaginal exposure processes, specifically utilizing the outdoor environment, as well as cognitive restructuring, showed a significant reduction in dissociative symptoms, improved ability to manage imagined exposure, and overall increase in quality of life. In the article, The Efficacy and Acceptability of Psychological Interventions for Adult PTSD, a network pairwise meta-analysis of randomized controlled trials, conducted a meta-analysis over 157 randomized controlled trials, including efficacy of treatment for adults with PTSD. TF-CBT was found to be the most beneficial for clients as compared to EMDR and other trauma-focused and non-trauma-focused interventions. While treating Maria with TF-CBT, it was really important out the gate to establish the nature of the therapeutic relationship, which is founded in collaboration as well as an active partnership with myself, the therapist, and Maria, where she's expected to come up with her own goals, specifically goals of reducing her dissociation, reducing her depressive symptoms, increasing her intra and interpersonal capacities, and her ability to have a cohesive and functioning intimate relationship with her second husband. Now, psychoeducation, where I would and have been playing a expert role, is utilized such that she understands why she's having these reactions to her sexual trauma that she experienced as a youth, and she's able to basically not feel so isolated. Now, moving on to the middle stages, we still utilize psychoeducation to, again, reconfirm that she should not hold any stigmas, or at least reduce those stigmas that she holds in regards to herself. We're going to build her skills, utilizing breathing techniques, anything we could do to reduce her stress levels. In addition to that, we're going to use a combination of exposure as well as trauma narrative. Both are utilized such that she's able to relive through her traumatic experiences such that she's able to process them and then be able to tell her own tale, tell her own story, so she can live more functionally and experience less dissociative symptoms, all of which have proven to be effective in Maria's case. And we're going to utilize cognitive restructuring such that she doesn't hold these negative thoughts about herself, and we're going to be able to bring them more in balance with reality. And then the termination phase, we're going to summarize our progress. And again, we're going to be reassessing throughout so we can get a baseline. And once we feel like we've met Maria's goals, we're then going to reinforce these skills and schedule a final session so we can have some closure. In this case, the cognitive distortion is overgeneralization, as Maria has identified feelings of worthlessness. Now, as a therapist, I would then challenge that cognitive distortion, point out the fact that, now, Maria, haven't you donated a lot of your time? Haven't you helped others through volunteering? She's then going to sit back and think, well, I guess I'm not completely worthless. And then we're going to replace that thought with something that's more balanced. Like, well, maybe some of the times I do not maximize my opportunity to be productive, but that doesn't mean I'm worthless. I still do things that are productive for others and my society as a whole. Thank you so much for your time. I hope you enjoyed this presentation on the case conceptualization of Maria and TFCBT.